Well, friends, we'll wait for a few more participants to join. Dr. Anuja, Dr. Unikrishnan, you take over.
Yeah, okay.
Sir. Okay, sir. Good evening, sir. Dr. Uni, sir?
Yeah, hi, Dr. Anuja. Yeah.
Hello, sir. Sir, I think maybe we can wait for another 5 minutes and then we can start with our
Yeah, sure. 7:30.
then move ahead. Right, sir.
So what would the plan be? Like how to?
We are seeing all the participants who are there with us. Maybe we can take a one-to-one feedback from them, how they have benefited with all our structured basic presentations.
Yeah, actually we
And
can.
then
They take them, ask them what they really feel they want.
Dr. Anuja, we have got only 12 of them as of now.
Right,
So
ma'am.
shall we wait for 5 more minutes and
Yeah, we
then
already discussed that. 7:30 will start.
yeah.
Vijaya madam, we'll be starting at 7:30.
Right, fine.
So we'll take their feedback and also let us make it truly learner centric. Let us ask them what they actually want and accordingly.
I think we can start now.
Yeah, okay.
Uni sir, please, you are starting.
So how many of us are there? There are 16 of us. No? So first of all, ENT. So first classification would be ENT Ophthalmology, right? I think it will be
Right, sir.
time to.
We'll have to divide the group into ENT and Ophthalm.
Yeah.
We can ask them to express themselves. The way forward, so you can start taking.
Yeah, I'll just generally tell just to remind everyone as we say, the gentle reminder. The whole idea of this was for all of us to guide each other and learn the way of going ahead in the curriculum as per CBME prescription. And for the main things we had spoken about in our talks. So now the main things just to remind you all would be first of all to make SLOs based on the competencies depending on each institution, infrastructure, etc., etc. The next thing would be to make the curriculum, specifically the timetables, and the next thing would be the assessment patterns, including the logbook processes. These three would be the broad groups. So it's up to all of us, and especially all those of you who have joined, to decide what aspect you all want to. We want to make it a truly learner-centered thing. So I think, as Dr. Bedi sir said, feedback from everybody. Yes, Dr. Anuja, anything else?
Let it be. Let each one of you. We can take each one's name. We can just start with Dr. Binu George. If you could show your video if possible, and say something about. So 16 of us are there, so we can take. All of us can take turns to express your own opinion. Dr. Binu, can you start?
Yeah, this is Dr. Binu here.
Yes.
Actually, we also have been asked by our
video also.
Pardon?
Yes.
I'm
those
yes,
are speaking. Binu, you can just say your ENT or Ophthalm and to say the medical college institution wherever.
Yeah, I'm Dr. Binu. I'm associate professor in ENT at Government Medical College, Thrissur. Actually, we also have been asked by our MU group, by our CME coordinators to start preparing timetables. So, one doubt which I had was how to divide this among the phase 2 and phase 3. So, is there any specific pattern or specific number of CBMEs to be allotted in the fourth? And probably the theory, I think everything has to be taken in the phase 3. I think. So how to divide it, and it was a bit tough for us. But anyway, for the phase 2, we have already given a timetable, but the teaching learning methods and the assessments we have not yet submitted. So I think with this program, I think we'll get a good idea as to how to do it, but I think it will take some time for us to really get a grip of the whole thing.
So I think those of you who are in the curriculum, actually, I am not. I've made one thing clear. I'm not in the curriculum committee. Some of these things are not really. I can't fully answer. Those of you who are there in the curriculum committee would be better placed to answer some specific questions.
actually, those who are in the curriculum committee,
Dr.
many of them
Unikrishnan,
just
this
don't
is
know.
Dr. Vijay Lakshmi.
Hi, hey.
What I have done is in our institution, I'm also a member of the curriculum committee. What I have done is second phase, when they do not have a theory postings and they will theory classes and only the clinical postings, I have picked up only the very basic things like symptomatology associated with those competencies, history taking in the year, examination of the year, those basic things, and put that for the clinical postings, the
Phase
first
2.
posting. So only 20 competencies, only 20 things we have picked, 20 topics actually. I can share that probably tomorrow.
So actually what we would
What I have
want to, I would like to just respond to that in two parts. One, to answer Binu specifically, the MCI or NMC does not really prescribe what goes in phase 2 and 3. It's up to us. The second part is what we actually planned is for us to make groups amongst y'all and y'all discuss and come up with options. Actually, that was the plan. Rather than a straight QA session, just a gentle reminder that was the original plan. But yeah, as Dr. Vijayalakshmi said, the common sense way forward would be to take the most basic ones, about 20, and for phase 2, right? That's right. That's what.
Can I add something, Uni sir?
Yeah.
Yeah, just to thank you, Vijaya ma'am, and just to add to what Dr. George has added, as Vijaya madam said, what we have done is actually we've been given 4 weeks of posting for the second MBBS. And when you have 4 weeks of posting and they're not being posted on Saturday, it almost comes to just about 20 days that they'll be with us, 5 days a week. So what we have done is that in our institute, and what we've done is we've taken up the competencies, the part we were actually covering in their original 6th semester. So we are looking at, say, the competencies with nose and oral cavity, and that is the clinical aspect. And we are moving with that, mainly the skill training and for their morning clinics. But as Dr. Uni sir has said, the main point was that out of all the outcomes that we have in ENT that I'm discussing, we have total 72 outcomes that are there for our otolaryngology. So the point is that we all maybe if you're a small group on this, or if you're a large group, we'll divide them into small groups, and we would be making and framing learning objectives for the different competencies. The mapping of the curriculum, Dr. George, that will be the main part, that how you would be fitting in your competencies in the concept of lecture, demonstration, STL, would be towards the latter part. We need to first frame our SLOs. That's the way I look at it. And I think, as Uni said, sir said very well, we would be learning from each other through the course.
You're very right, Dr. Anuja. That is the way forward. We need to actually pick up each competencies, frame the SLOs, and then plan the learning methods. And based on that, we need to plan our timetable completely. That is how we can do it.
Yeah. So.
Maybe, sir, Dr. Nandita is next, sir. Dr. Nandita Chaturvedi.
Good evening.
Good evening,
Good
madam.
evening. Am I audible?
Yeah. Go on.
Yes, madam. Yes,
Yeah.
please.
Hi, I am Dr. Nandita Chaturvedi. I am assistant professor in ophthalmology at Government Institute of Medical Sciences, Greater Noida. So, one issue that I had was earlier also I had posed this question. It was addressed also earlier, but somehow maybe I'm not getting the hang of it. Okay, the clinical postings that we had, are we supposed to define the competency for each clinical posting also? Suppose they're here with us for 20 days. So for each of those 20 days, we have to define which competency will be covered on a particular day. And also because in ophthalmology, the certifiable competencies are very few. So how would we go about distributing their clinical posting, in a more structured manner? I was a little confused about that.
Hi, Dr. Nandita. This is Dr. Rashmi here. Uh, yes, actually, we do have to. Whatever sessions we are taking, we do have to define our competencies, including in the clinical, because the timetable which we submit to MCI at beginning of each session, it requires that to be very clearly spelled out. And how we are achieving that competency, whichever phase it is, whether it is in when they are in phase 2 or when they are actually exam going with us. So, like it has been pointed out by Dr. Anuja, we need to first of all define those objectives of each competency, including clinical and theory. So, that is
Right.
yeah, yeah.
Okay. Okay, ma'am. Okay. I think I'll get the hang of it better as we go along, making the
Yes,
competencies.
yes, yes. Actually, if we start defining our objectives or convert the objectives, this whole process would become a little easier. Objectives followed by TL and the assessment part. So our
Right,
entire
ma'am.
process, would become a little bit easier. So
Right, ma'am. Right.
yeah,
Okay. Thank you, ma'am.
thank you.
Dr. Priyanka is next, sir. Uni, sir.
Please, please, Harshit, don't have to take my name, please. Please go.
No, no, sir. Actually, because you're there, so you're moderating the session for totally. So just to add on
Oh,
to that.
okay.
Hi, Priyanka.
Yeah,
She's
okay. Next,
Hello,
please.
good evening. It's Dr. Priyanka here. I had just one point to ask. I'm an ophthalmologist, assistant professor in government medical college, Kathua. While preparing for the clinical part for um, phase two, when we'll be getting 4 weeks clinical posting. So we have seen the competencies given in the MCI booklet. So from that we have made it out. But how can we teach visual acuity assessment and all before going on to theory classes?
well, Priyanka, to answer it simply, whenever we are teaching any skill, the knowledge component is a part of it. So normally our clinical sessions are 3 hours, right? So if they are posted with us for 1 month, that is 4 weeks, we'll have to start with a bit of theory. So if you just think of visual acuity assessment,
Okay, yeah,
we
that's
don't
what.
really need too much theory in it. See, what we need to teach them is what is the
That is
pathway.
okay. But refraction part,
Correct. Actually, if you see now, most of it we can just do with the superficial part of theory. We need not go into too much detail.
okay, yeah,
Simple things like
okay.
conjunctivitis, examination.
It is
Yeah,
about
we can do
we
with that.
talk of horizontal and vertical integration, right? It is about integrating the knowledge and the skill component within your clinical posting and teaching it. So you need to link it up and teach it combined so that their understanding will be better.
We have to give a short lecture first about that topic, and then we'll go for the skill, because refractive errors and all, we can just teach visual acuity assessment.
Yeah,
But
actually, see,
later part refraction, we can keep it in the next posting.
actually, refraction that way would be easier to teach because they can actually do something like a self-directed learning, go refer to various sources
Okay.
in the next day and make their own presentations about what they understand by myopia and all. Because actually optics is in normally not related to our diseases of the eye. So diseases may require a little more
Okay. Yeah.
understanding. So optics can be a very simple, it's physics basically. Yeah. So
Okay.
actually,
Okay.
optics
That
is
we
one of
can
the,
do.
if you ask me, I would say optics and conjunctiva or maybe even lacrimal system are some of the simpler topics to teach in the fourth term because they would still remember a bit of physics. They can still go and do their own literature search, their own Google
Okay.
search. So, we can be a little innovative, make it into a SDL session, come with your presentation, and then show them,
Okay. Okay.
how we are prescribing lenses or how we are doing those things. Simple
Okay.
things like dilating
So
drops.
we can keep. Yeah.
Yeah. Please ask. Please
Okay.
ask.
Good. But one thing, like, can we keep the same competency in the next level also?
Yes,
Or no,
yes.
we cannot repeat that while
We
making
can. We can see, we must remember that whatever
we can.
competency we are talking about, it needs to be built up. So
Yeah.
if there is something very simple, for
Yeah.
example, visual acuity testing, maybe even if we finish it in
Yeah.
fourth term, we again need to re-emphasize it. The time allotted may reduce now.
Yeah.
Yeah, but we can't say that you have to take a
Yeah.
case now and I will not again teach you visual acuity. So
That is what I was just worried. Can we take that competency again in that timetable of
yes,
fourth year?
yes, we can.
Yes. Okay.
Because
Okay.
even when we are
Okay.
dealing with
Okay.
subjects like
Okay.
community
Thank.
medicine, which are starting from phase 1, so there are many community medicine
Okay.
competencies which are starting in phase 1, but they are continuing up to phase 2, phase 3. So that's how their timetable is looking. Same thing will happen for all the 11 clinical branches where they are starting clinical posting in phase 2. So it's a competency. So, we
Okay.
have to build it up, we have to reinforce it.
Yeah. Okay. Okay.
Okay.
Thank you. Thank you.
Thank you, Priyanka. Thank you for the question.
Yeah, who's next?
Who do we have next now?
I think we have Dr. Manisha. Dr. Manisha.
Yeah, Dr. Manisha Sethi. Yes.
Absolutely, madam.
Yeah.
Madam, would you like to say something, or you have any questions? Dr. Manisha?
Good evening.
Yes.
Good evening. I'm Dr. Manisha.
Yeah, okay.
Actually, me and Dr. Priyanka are from the same college, from same GMC Kathua. So we were making timetable and we have certain queries which we have clarified.
So, madam, you're also from ophthalmology or you're from ENT?
Ophthalmology.
You're also from ophthalmology.
Okay.
Okay.
All right. Thank you. Thank you, Dr. Manisha.
Yes. Dr. Sangeeta. We have Dr. Sangeeta. We have I think somebody's raised hand.
Yes, ma'am. Hello.
Yes, madam. Hello. Yes, madam. You're audible.
Yeah, ma'am. Yeah, okay. Thank you. Good evening to everybody.
Good evening.
I am
good
associate professor in the Department of Ophthalmology from Sri Devaraja's Medical College. I'm not in the curriculum committee, but I am in the department. I handle the curriculum. We all faculty, we have prepared the SLOs and we have submitted, and we have also prepared the logbook for phase 2. So we have to prepare for phase 3, madam.
Okay. Your logbook which you are preparing will continue, right? Phase 2, phase 3 for Ophthal. How is your college planning it? You're planning phase-wise this thing or subject-wise?
Yes, ma'am. Phase wise. We have our MEU committee there. So they have instructed, and right now we have prepared only for phase 2. We have submitted, but I don't think it is yet to be implemented, madam.
Yeah, I think because your your exams are still going on, right? Your phase 1 exam have not yet gotten over.
Not yet.
Yes. So I think they'll also be joining by 1st of March or something.
Yes, ma'am. Yes, correct.
Yes, correct. But when you made your logbook in Ophthal, so you made it as per the template of MCI. Did you put up the skills and all there? Or
Yes,
just
definitely, ma'am. We followed everything according to the MCI only. The pattern, the format given by MCI. Everything, the skill lab module also according to MCI only.
Okay, and you have put up the topics there, or you have just written skill lab and you have just written like case discussion? You have broken it up into further smaller.
We have fragmented. Definitely, we have fragmented. We have put the topic, the number of hours also, the pattern, and how it will be assessed also. For each the competency, the assessment tools also we have entered at the bottom of the table. We have all prepared it in a tabular column for each competency.
Okay. So that's very good because what Dr. Sangeeta has done will be a good learning experience as we are discussing along, because this is the point most of us are busy making that logbook. So it will be a good experience, in one of the subsequent sessions to learn from Dr. Sangeeta how she has designed it.
Yeah,
So
yeah.
Yeah,
yeah,
yes, ma'am. It's
yes,
the effort of all the faculty of our department. We have
yes,
distributed the work among all our faculty, and we have done it together as a team.
correct,
We
correct.
have
Because
we
that
have
is how.
divided chapter wise, ma'am. Like
Okay,
one lids has been given to one faculty, cornea, retina, lens, like that. Each one has taken
okay.
the responsibility of forming these SLOs and etc.
For each one. Correct, correct, correct. Yeah. So I think as after this, when we'll be splitting the groups, so in Ophthal group, we can definitely have a experience sharing about this part. So it will be good, it will guide others also in how we can make it more simpler.
Yeah,
So
ma'am. Sure.
uh, thank you, thank you.
Thank you, ma'am. Thank you.
Any doubts or any suggestions for moving forward?
Can I ask one question? I'm Dr. Manisha.
Yeah, yeah, Dr. Manisha. Yeah, please do.
We have got confusion about logbook. How do we
Okay.
have to make logbook for phase 2?
Yeah, see, any clinical posting where the students will be posted, right? We have to make a logbook. The logbook template will be like how it is given in the module and how Dr. Unnikrishnan sir had discussed last time. So now in that we need to break up again, what are your skill lab thing if you're doing anything? What are your case discussion topics? What are your further skills which you will be training? So that's what I was just asking Dr. Manisha if she has done that. So that's how it will have to be done.
Thank you.
Yeah,
Hello.
next. Who's next?
Yeah.
Hello. Hello.
Yeah.
Dr.
Who's this?
Dr. Inchira here. I'm
Yeah.
from the Department of Ophthalmology. Same as Dr. Sangeeta, I'm from the Sri Devaraja's Medical College, ma'am.
Okay.
Rashmi, ma'am. Hi, ma'am. We have met
Hi.
you in the wonderful workshop of bioethics.
I know. I was just the moment you said Devrajesh, I was just thinking that yes, we would have met that time.
Yes, ma'am. Yes, ma'am. Yeah. Coming to this, as ma'am told, we have all, distributed each chapter, and we have done SLOs, OSCEs, everybody in the same topics, ma'am. So
Okay.
that way, in preparing the logbook, it was, I mean, easier. Like each one
Right.
gave the inputs for fourth term, the phase 2.
Okay.
That means
Okay.
phase 2 logbook. But in
Right.
logbook, I had a doubt, ma'am, that for the skills, we give them chances, right? Like in logbook, you design the logbook telling that you'll to certify that the student has learned this skill, we give them 3 to 4 chances or 5 chances.
Right. Right.
Ma'am, what is the basis? Like how, see, before this CBME curriculum, we used to teach them basics of ophthalmology in fourth term, in theory
Right.
class, and also in clinicals.
Yes.
So it would be easy for us with the theory background. We teach them clinical, aspects. Now we have only this thing like 4 weeks of clinical demonstration classes. We teach them, and with in the logbook they have to. We just have to, with the attempts they take, we have to assess them.
Right. Right.
Right, ma'am. So how
Yeah.
many, like, on what basis? Like, I'm asking how many attempts each skill has to be. How do we decide that, ma'am?
Yeah, actually, like you said, you have already made the checklists and all, right? So there can be some things, there can be multiple options of doing it. One simple thing which I was thinking was have some critical steps there, and a basic minimum score. So if we decide that, okay, these are the critical steps, and if a student does not clear this, he can be asked to do a repeat. Some critical step which he doesn't do, he may be asked to do a remedial or a certain score. If he doesn't reach a certain score, he may be asked to repeat, he may be asked to do a remedial. So this is something which, as we practice, the first batch which comes, and as we practice is, we are just going to learn along the way that, okay, fine, this works well. So probably our first 1 or 2 batches, that demarcation may be a little fluid, because we can't really be 100% sure how they are doing it. So especially departments which are not yet doing the OSCE pattern of checklist for teaching training, okay, they will find it a little difficult. The ones who are already doing, they will be a little in a better position to decide, okay, this is the way I can put off my cutoffs. So in our subsequent discussion, I think probably for Ophthal, we can actually start off with this part and then move on to the next one. How will we decide these cutoffs and all?
Okay. Yeah. And even in the logbook preparation, ma'am, like we have prepared logbook, do we have to put that checklist? Like in OSCE, what checklist we have
No.
or just one
Back-end
heading?
document. Yes,
Only heading should be there, and two, 3 pages should be left for like repetition of the
Yes, exactly.
Okay, ma'am. So checklist should not be mentioned in the log.
No. Checklist is your backend document which says that you're doing this using a OSCE pattern checklist. So that's your backend internal document.
Okay, ma'am.
Yeah,
I think
not
here we have gone, we have designed it like that. Like
Dr. Sangeeta and
yes, ma'am.
Dr. Sangeeta and Dr. Inchara, nice work. I just wanted to know, have you brought in any scope for documenting the feedback that is given to the student? Because here we are going to have repeated assessments and, till they get certified, till they are, they reach that certifiable level of competence. So are we having any system of documenting the feedback? Is it also going into the logbook, or what have you done? You got a separate system for feedback? What have you done?
Feedback for these OSCE and OSCEs, ma'am?
No. I think ma'am is referring to the certifiable skills. I think ma'am is referring to the certifiable skills. So when so she wants to know whether we have any documentation for the feedback that we give to the students after they perform each skill. Is it that, ma'am?
Yes, because based on the feedback, you're going to tell them to either like certify them, give them a feedback and tell them their areas of improvement, or where they have done badly, and then you're going to ask them the remedial and the repetition of that particular task will be done, and then till they get certified, right? So that is the thing. Where are you going to document that feedback? Is it also going to be in the logbook, or you're having some other system?
No, ma'am, it is there in the logbook which we have prepared. There's a column, there's a row there at the bottom where we have written remarks. So in that remarks, we will write their, based on their performance, we are going to give the feedback. So where they have to improve,
right,
and which part they have done it very well, appreciable part, all that will be mentioned in that column.
Okay, right.
Actually, this feedback by teachers is an inherent part of that logbook. So it is there. Even in the first year, it was like that. The phase 1 logbook is also like that only, where the feedback by teacher is an inherent component of this whole thing. So
because our assessment is incomplete without feedback.
Exactly. Okay, thank you, Dr. Sangeeta and Dr.
Yes,
Inchara.
thank you, ma'am.
Thank you, ma'am.
Sharing your wonderful experience, So good, thank you. Okay, so next we have, Dr. Manisha. Dr. Nandita Chaturvedi.
She spoke.
Ma'am, she spoke. We have Dr. Meenu now.
Okay, Dr. Meenu. All right.
Yeah, hello everyone. Good evening. I'm Dr. Meenu Ramakrishnan. I'm Professor of Ophthalmology, KJ Somaya Medical College, Mumbai. Thank you so much for the wonderful presentation. And actually, whatever I wanted to ask has already been asked, because we are going into second year now. So we have still not made the logbook or the SLO. So we are looking forward to making them.
Okay.
Okay, ma'am. All right. So I think in Ophthal, this will be one of the probably the first thing we can plan out. We can just yeah, because that is something immediate deadline. So once we get that momentum, probably we'll be able to probably not go the way everyone is going and start with objective, but maybe a discussion on logbook will really guide us as a group to move forward.
Yes,
So thank
yes.
you.
Thank you.
To working together. Okay, so
Rashmi ma'am, I think we will have to motivate the ENT surgeons to be more here. We are all
Yeah.
ophthalmology only.
You know what?
And
I was under the impression that it is most of it is ENT crowd, but
even
yeah, but I did not. I knew Dr. Priyanka was opthal. I did not know about everybody else.
Yes,
So
ma'am, I'm also so surprised because we have all ophthalmologists and we
yeah,
have taken so many examples from ENT. And it's such a wonderful experience because we are learning together. We have so many things we are sharing together, and that
yeah.
will definitely
I
help
think,
us.
yeah, sorry, Dr. Sindhu there? Dr. Sindhu
Next,
Vignath, I know she is ENT.
Yes, I'm Dr. Sindhu Vignath, Additional Professor, Government Medical College, Trivandrum, ENT surgeon. Actually, we were also asked to submit the list, and we had already submitted just the timetable, not the detailed list. We have selected 20 competencies and submitted. We have to make the detailed SLOs and all, and we are struggling with that. Not yet submitted.
Yeah. So yeah, so this whole forum was actually to help with that struggle.
So, we could do this to really together. This is the right time because 1st March they are joining, and this will be the best time that we were doing it.
So I seriously feel we might have to, for the next couple, maybe the next 3 weeks, we might have to meet twice a week, maybe.
Sir, we'll have to first probably, with the help of Bedi sir, try to inform even more ENT people to be back on the forum, and then we can move because Doctor, we have sir, some more people are there, I think, still who are
Can you
there.
actually show of hands? ENT kitne hai actually? As you said, we are totally taken by surprise.
Yeah, sir. I think no, sir.
Oftal छुपे रुस्तम निकले.
Sir, दोनों से एक ही boat में we are just more here. But I'm actually happy. I'm so happy to have a group where even if it's a small group. So because I was really thinking, मैं इसीलिए even discussion I was not contributing. I didn't know what to say because it was all
Yeah.
Rashmi ma'am, all your power all over. We are so learning so much. I've learned so much of Ofthal already.
Yeah.
Nana, my power increases. As I learn more, the power increases.
Dr. Ruchika Agarwal has raised hand.
Yes,
Dr.
sir.
Ruchika Agarwal.
Dr. Ruchika and Dr. Faiz, they are both there, sir, for ENT, sir.
We'll just hear from
Dr. Ruchika. From where?
Yes. Hello.
Yeah, hello, Dr. Ruchika.
Hi, sir. Hello, everyone. I'm Dr. Ruchika. I'm from Gorakhpur AIMS, and I'm also a single faculty. The department is just developing here, and I'm in a process of this logbook making and being a single faculty. And I know that lectures are also coming up here. We have already started the patho classes. I guess 2-3 months have already gone. We started in October only, the second phase. Hello.
Okay. Yeah. Okay.
So we are expecting by October or something we'll have our batch for us here. So I have to be prepared with all those logbook, and it's been really good learning. Many times I have not been on the actually live on the class, but I have learned a lot from the videos that have been posted, the classes which have been
Good. Yeah.
later. But as for the time, I actually try to join those and learn from that. So it has been really good. But I'll definitely give an just a suggestion. If we could have a common forum where we can all share our logbooks or plan, and then senior and experienced people can edit or what can be done, what should be done, so that we have a uniform sort of thing, something like a Google form or a Google doc where we can all share the thing, this should be done, this should be omitted, or this can be done. If we could arrange something like that.
Actually, the idea of this groups is like we form small groups of 6 to 8 or 10 maximum, and then sort of like it's like a homework. So you all have to interact with each other within the group, and at the next meeting when you meet, you all have to present what is done. So that is the general idea.
That would be really helpful.
Yeah,
But I guess the timing might be a bit different for everybody to join, and so it has to be coordinated in that way as well, I guess. So just that suggestion, but it has been, the whole experience has been really good, learning about all these things, and CBME, which is never taught as a senior resident, as a resident anyway. So that's really good.
Yeah. Next, Hudab.
I think we've taken opinion from everybody, sir, and we could put on the group for more of us to join in time, so that next week we could be having the group, and depending upon the group strength, we can divide.
Groups, no. So, do we make it, or really, because unless we have everyone on board, how do we start making the groups? At least there has to be discussion in the main group about forming the groups, not just amongst us faculty.
True.
So the idea would be to have about anywhere between 6 to 10, not less than 6 and maybe 10. That's what I am thinking. And with at least one or two, ideally at least one or two who have done the something related to medical education, RBCW or something.
Sir, can I just speak for Ophthal for a minute, please?
Yeah, sure.
Yeah. So if it's okay with the Ophthal participants, we can form a single group right now, because I can see only so many of us are there.
Yeah, true.
And so Ophthal will make one group and we'll work collaboratively. If we have more participants than 20 for the group, then we'll go for a second group. But I think it's about 10 of us probably right now. So if it's okay with all of you, you can just, so that way, at least, we'll kickstart the discussions.
Absolutely.
Yeah. So if all the Ophthal participants here are okay, Dr. Sanjay, if it's okay, we can probably, Dr. Sanjay Bedi. So if it's okay, Ophthal will form initially just one group.
Yeah, I think so. I think we can start taking decisions and moving ahead.
Yeah, I think so. So I think after this one, next week, we'll just, we have our WhatsApp group, I think. So either we can continue or we'll just split the group there. So, we can have independent discussions. Right? Yeah. So I think Dr. Sanjay has made already one Ophthal group, which we had merged with ENT. So we can just put up on the topic and the time, and we can have a meeting next week then. Right?
Yeah.
Okay, sir. What about ENT? You also want to start with a single group first?
Yeah, looks like as of now, if you're seeking today's status, then definitely I think hardly 4, 5, 6 ENT.
Okay, so
Tanuja, right?
Dr. Yes, everybody has agreed to this from Ophthal. Okay. Yes. Yes, Dr. Sindhu has also said okay. And where is the chat gone? Okay. Yes, we have a yes from everyone for this. Dr. Ruchika, Dr. Sindhu from ENT have said a yes. Okay, Nandita. CBME Ophthal group is existing. All right. Am I a part of that, Dr. Nandita? I'm not very sure. Am I in that WhatsApp group?
Ma'am, I'll just check and let you know.
Yeah, sure. In case I'm not, you can just add me in that group. Okay. I think rest.
Okay.
Yeah, because combined mein I'm there. I'm not sure if I'm in that ophthal group itself.
Okay,
So you can.
ma'am, I think Dr. Sanjay will have to add because he must be the admin of that group.
Sure. You can just put up. I'll also put it up. I'll put it up. He'll add
Okay,
me.
ma'am. Okay, I'll put it.
Sure, no problems. Ji, Dr. Unnikrishnan.
Yeah.
Yes, how to proceed? Yeah.
Dr. Uni, I think we are only 6 of us ENT, so we'll also function as a single group only, and we'll see as and when people join us, we can see how to take it forward.
Yeah. So what?
So we will. We don't have a separate WhatsApp group, right? We may have to create that to decide when we're going to meet next.
Yeah, जो ENT ophthalmology वाला है, that can be split. No, I mean those are ophthalmology can just go back to the existing ophthalmology group. That's it. In the combined group, when the ophthalmology exit, then become ENT. The combined one जो है, the ophthalmology people once they exit, it becomes an ENT group.
Yes, I think so.
Okay.
Because
we make multiple groups.
Faculty group, there if we want, we can continue to be together. We learn from each other's experience. And
So I don't think I'm part of the other group. So anyway, I'll ask one of you to add me in that.
I think Dr. Sanjay, we can add you, no problem. Like even I'm not a part of the ophthalmology group, so sir can add both of us to our individual faculty groups. So okay, all right. Okay, so shall we call it a meeting then, if it's okay with everyone?
Yeah, so then I think we need to at least have very regular discussions, at least in the individual dedicated WhatsApp group.
Yes, I think we can go like how Dr. Anuja had
like
said.
If there's an issue with as somebody was saying, the issue with timing, so I can understand that there can be an issue with common meeting timing, but at least let's have a flow of discussion in the dedicated groups. People can post their doubts. People can actually start posting what they've been doing, and we can take it from there. I don't think. I mean, if we insist on this sort of meeting, on this day, on this time, maybe we'll have less people. So in a WhatsApp group, the flow of discussion can go on happening the entire day. This is frankly what I feel, because I've seen this happening in many groups. When we insist on a certain time, everyone meeting, it just doesn't happen. Other than that, if the WhatsApp in the group itself, if the flow of thoughts and doubts, everything goes on happening, then that works fine.
Okay, yeah, I think we can take call for each of these things, because initial some meetings where we actually have some presentation, objective learning, that would help a lot. So
yeah, I agree. Perfect. Actually, that is the ideal thing, but some I'm just suggesting compromised formula.
I agree. Okay, so I think that's okay. We can take a call. All right. So thank you, everyone. And it has been a great learning experience. Hopefully, we'll again get back the ENT ophthalmology group once we, reach and do some good. We can have a experience sharing or a best practices session together then.
Yeah.
Okay, then. All right. Thank you, everyone. And let's meet the individual groups then. Okay.